Yep. All right. Okay, and if everyone's good on white balance, you need sound now. Yep, I'll keep it up here, and we'll probably have. All right. I think we'll have 3, maybe 4 again. Let's see. All right. Guess we have a much smaller camera contingency this time.
Right.
Ready for mic check? All right. We'll probably be around this level. Hopefully we will be starting not too far past the scheduled time. Is everyone sounding good? All right. I guess that's all on you because we're all going wired straight in. No bulk box today.
Oh, yeah, they are our wired.
All
It's a
righty.
small group. So
Yeah.
we're good.
Cool.
Thanks. Mic check, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, live at SCEMD.
Testing, 1, 2, 3, testing, can you hear me? Testing, 1, 2, 3. Testing, can you hear me?
Just a heads up, guys, we're kind of holding for a little bit for some of your colleagues from the upstate to arrive there. We got people on the way from out of town, so it's going to be a few minutes. What? I'm not sure. Quick mic check, and just want to make sure for the latecomers, Holly, if you want to get in, just make sure that you have Holly in your shot the entire time. She's going to be doing sign language for us. All right, is everyone good there? All right, we'll be ready in just a minute.
I'm fine. Okay. Y'all, thank you for coming. Holly May, thank you for being here. As you know, and we thank you for coming, we want to be sure that everyone in the state is kept up to date with the latest information. So here we are to give you some information and answer questions. Dr. Rick Toomey of DHEC.
Thank you, Governor. Good afternoon. As you know, we are continuing to monitor and respond to possible cases of COVID-19 or the coronavirus in South Carolina. At this time, the risk of contraction of COVID-19 remains low to the general public. We, along with our state partners and public health officials around the state, have been preparing for the introduction of COVID-19 in our state. It is here, and our systems for limiting spread and caring for those affected are working. As an update from late yesterday, DHEC received a presumptive positive result for one additional individuals who were tested for the novel coronavirus, COVID-19. Dr. Bell, in her comments, will provide a little bit more information. Currently, we are on the monitoring of patients. We have completed, we've completed 56, 16 remain in monitoring. Of those tested, we have 24 negatives, 7 positives of the 31 tests that we have conducted to date. With regards to the recent Richland District 1 announcement, DHEC did not advise students to stay home from school or self-quarantine. DHEC is not aware of anyone being tested. School districts should consult with DHEC prior to making decisions or announcements such as this. Governor?
Thank you. Today, we participated in a video conference with Vice President Pence, Surgeon General Jerome Adams, and Health and Human Services Secretary Alex Azar, whom we had had conversations with before, to report on how Team South Carolina is responding to the virus. Healthcare authorities in South Carolina continue to follow established protocols and procedures to address the virus. There is no cause for public alarm or speculation. Schools will remain open. And state government offices in all 46 counties will also stay open. South Carolinians should continue their normal daily routines and responsibilities. It's important to remember that each individual, each of us, is responsible for their own actions and personal hygiene. That's for our own benefit, your own benefit, and that of the community. All South Carolinians should continue to follow the recommendations and information provided by the official sources, and you've all heard it and seen it over and over. Cover your cough or sneezes. Wash your hands with soap and warm water throughout the day. If you feel sick, stay home and contact your doctor. Or from home, you can do something in South Carolina. You can consult with a doctor for free with MUSC, that's the Medical University of South Carolina's online coronavirus website. And that is found at musc.care, musc.care. As of this morning, 1,178 people have logged on to that website and have been screened by medical professionals. Again, ours is the only state that we know of that has this free service. As DHEC has pointed out, there's no shortage of testing kits in South Carolina. Your local doctor or health care professional can get you tested if they believe it is necessary. It is inevitable that more South Carolinians will get tested in the days and weeks ahead, and it is likely that we will have more presumptive positive cases. For perspective, the Surgeon General told us today that the coronavirus has a lower threat of mortality with children and young adults than the regular flu does. That's what he told me today in the meeting we had earlier, the video conference. Elderly people with underlying pre-existing health conditions such as obesity, diabetes, respiratory, or heart disease are particularly vulnerable to the coronavirus. We have seen that. Dr. Bell.
Thank you, Governor. Good afternoon. Late yesterday afternoon, March 8th, DHEC received a presumptive positive result for an additional individual who was tested for the novel coronavirus COVID-19. The older man is a direct contact, meaning he had close face-to-face contact with a previously announced presumptive positive case. He is also from Camden. He was evaluated at a healthcare facility. He is not hospitalized and is currently isolated at home. He was with these new presumptive positive cases, we now have indication of community spread in Camden. However, I want to reassure the public that DHEC has been preparing for the introduction of this virus in South Carolina for weeks, and we have planned, prepared, and tested our ability to respond to public health threats like COVID-19. Our contact investigation protocol is working, as we are appropriately identifying and connecting with individuals who could have been exposed to this illness. This helps us to limit potential spread while we continue to also identify potential exposures based on travel or other relevant history. It's all of our responsibilities to help prevent the spread of illness. Our key recommendations at this time are to stay home from work or school and to avoid public gatherings to protect others in the community if you are sick. Reach out to your healthcare provider if you are showing symptoms such as fever, cough, or shortness of breath. If an individual doesn't have a primary healthcare provider, MUSC Health is providing free telehealth screening to all South Carolinians. Anyone experiencing symptoms can visit musc.care and be screened without having to leave home. You can reach out to MUSC for more details on its telehealth screening. We're still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. I'd like to reemphasize that each of us has a responsibility to prevent the spread of disease, to protect our family, our coworkers, our community. Please stay home if you are sick and continue to practice good hygiene. I want to thank all of our public health officials, healthcare providers and healthcare facilities, and various leaders and groups across our state for their continued dedication to protecting the safety and health of South Carolinians. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. Thank you, and I'm happy to take any questions.
Does anyone have questions?
In
Yes,
5
ma'am.
days, thousands of people are going to descend into 5 Points for St. Patrick's Day Festival. I know that right now we're saying to avoid crowds. What's the expectation there?
We're asking people to avoid crowds if they have symptoms. If we're in a community where we don't have evidence of ongoing spread, which is not the case in Columbia area, for example, so there's no reason to alter our routine activities. There's no reason at this time to cancel any public events or take any special measures when there is no evidence of ongoing spread in a community.
Governor, you
Yes,
said
ma'am.
all office buildings are open now. What
Yes,
is
ma'am.
the trigger for deciding to close? What would cause that decision if he makes it?
Well, the closing the state offices, of course, would be up to me, up to the governor, but we are nowhere near that, and we will keep everyone informed on exactly what the progress is, but there's no reason to do that.
What about schools? Who makes that?
There's no reason to do that either. Dr. Toomey?
No, with regards to the question about schools, we are in constant contact with the school officials and working with them to make sure they have the latest information, and there's no recommendation at this time for them to take any action such as that.
Dr. Toomey, on Saturday, it was said that both patients then had received their tests on March 5th. That was Thursday. We didn't hear about the presumptive positive test until Friday evening. Why did DHEC wait until now?
Well, the question is the time lag between a DHEC test from our lab to the time that it goes to CDC and CDC responds to us with an affirmative positive. The CDC, we received the 2 presumptive positive confirmations today. So the CDC is collecting samples from multiple states, from all the states. So we cannot control their turnaround timeline, and so we received it today.
What are the steps that schools should take if they believe that students have been exposed to the coronavirus?
So we recommend that schools continue to take the measures that they've always taken to exclude individuals if they're sick. And this is something that we cannot emphasize more. It's the message that we've always given, and it is the message that it's effective. If students or staff members are ill, they should stay home. There's no reason for other individuals who are not having symptoms to curtail their activities. And so we have guidance for schools for a variety of conditions for the measures that they're supposed to take for each specific diagnosis. But we ask that people monitor for symptoms and stay home if they're sick.
Do you think that Richland 1 notification was pushed out too early?
Without information about widespread transmission of the disease in the community, there's no reason to do school closures, and there's no reason to ask individuals who are not sick to stay home or to quarantine if they haven't been in contact with someone who's diagnosed or they are someone who's ill.
So that actually goes back to what could trigger that sort of decision? Is it the widespread, it being widespread in the community that could cause something like that to close?
We monitor absentee rates, but this is something that we take under consideration during each flu season, in fact. So even during the flu pandemic, we were making plans for the possibility of school closures, and we've never have not taken that measure statewide. Occasionally school districts do make their own decision if there are high absentee rates or if they don't have sufficient staff to provide a safe educational environment. But if there is not evidence of ongoing spread in the community, there's no reason to close schools.
Yes, ma'am. Over there. Yes, ma'am.
Thank you. One person's caught face-to-face. Can you confirm if it is still, could be airborne or not airborne?
So in healthcare settings, we have terms that have a specific meaning that might be different from what they mean to the general public. When we refer to airborne transmission, that means that there are very small micro droplets that remain suspended in the air for long periods of time. COVID-19 is not in that category. We consider it to be spread by respiratory droplets, which are larger droplets that actually do not remain suspended in the air for a long period of time. And that's how we define close contacts. If you've had close face-to-face contact with an individual who actively has symptoms and could be exposed to those respiratory droplets, those larger respiratory droplets.
To clarify, how many cases have we gotten back from the CDC for confirmed positive?
We have confirmation from CDC of 2 cases.
Director Jimmy, can you clarify, Richland 1 made the announcement about the 5 self-quarantine students without DHEC's input, and that was not your recommendation?
The question is, yes, they did not consult with us prior to that announcement. So we were not aware of their action decision, and if they had consulted with us, we probably would have, as has been said here, told them that that was not a necessary step. Not a necessary step.
Is DHEC testing the person that was mentioned in
No.
that press release?
No, we're not aware of any test for that individual.
And if you could clarify also, how many people have been tested? How many people have asked for
I can answer. We've tested 31, no, let me make sure. We've tested 31 actual submissions of a test. 24 have been negative. 7, as of yesterday afternoon, late, was positive. We've received from the CDC 2 confirmations of that 7, so 5 remain presumptive at this time. To go back to it, we are monitoring still, well, we've completed monitoring of 56 individuals. A majority of those were travelers that have come back in from affected areas. We are currently monitoring, that are still in the process, 16.
Where are the 2 that tested positive?
The 2 that tested positive was in Camden, Kershaw County, and 1 Charleston County.
Is there anything different in terms of airport protocol for travelers when they hit the airports? Anything different? Will you be scanning any of them as they're going through the gates?
No, not scanning individuals. The CDC has posted guidance for airports and airlines, and they have recommendations that should be taken if an individual is ill on a flight. And then there is an evaluation of passengers on the flight. Other than that, because of the large number of people that travel through airports, other measures are not necessary, and it's not possible to monitor those individuals in U.S. airports.
Are you all having any issues with the folks who've been asked to self-quarantine, and is there a penalty if they break that quarantine?
We have not had any issues with individuals who have agreed to self-quarantine, and should that occur, we do have measures that we can take, but it has not been an issue.
Any measures for the students returning from spring break that may have traveled outside of the general areas that are affected?
So for students returning from spring break from areas that we know to be impacted where there is ongoing disease transmission, we do ask that they monitor for symptoms and that they report their symptoms of illness along with their travel history so that we can have that additional information to fully understand their potential risk.
Does DHEC plan to open any specific location for testing? Have you concentrated at all in areas?
There's 2 answers to that. One, DHEC right now is the lab, the public health lab that is authorized by the CDC to perform tests. LabCorp and Quest have also received FDA approval late last week or in the weekend. So that provides another means for testing within the state. Doctors' offices can submit their samples now to LabCorp or Quest. The MUSC, as we mentioned, as Dr. Cole mentioned, has requested and is going through the process for their approvals for the FDA. Governor McMaster asked the FDA today to make sure they would consider and expedite that request. So we hope to see MUSC come on board. And the nice thing about that, the benefit is the more centers we have, it reduces the congestion of only having one site that is processing. Of course, we have only tested 31, so we're not overwhelmed. We have the capability of doing many more than that every day. And just making an assumption that there might be a follow-up question, we have sufficient supplies for those tests. People refer to them as test kits. Test kits are for the labs, and each kit for us provides opportunity for 500 tests. So we have 1 test kit and a second one. So we have the capability of over 1,000 tests at this point in time. And again, we've tested 31. And we have additional labs coming online for testing as well, and they will have the test kits as well.
What's the condition of the 2 confirmed positive patients right now, and where are they located, like which hospital?
All of the patients who have been reported to us as presumptive positive or confirmed positive are in stable condition and all are doing well, both those who are hospitalized and those who are at home.
Dr. Bell, we had talked about on Saturday hospital procedures. You said they're used to dealing with infectious diseases. Has DHEC given any new guidance to hospitals on how to start handling these cases as you suspect more and more will continue to be confirmed?
DHEC is providing additional guidance from the CDC for healthcare facilities, and we're also providing assistance from our healthcare associated infection section For facilities, there, as you can imagine, there are a number of questions about protocol and procedures, and so we are assisting with infection control practices, and hospitals are following the routine guidelines for the various levels of isolation.
So no changes to hospital procedure statewide at this time?
No changes to hospital procedure statewide at this time. We continue to disseminate guidance from the CDC as new recommendations come out.
What's the projected impact on healthcare workers throughout the state?
I'm sorry, repeat, please?
Is there any projected impact on healthcare workers throughout the state?
Well, because healthcare workers routinely have face-to-face contact with people who are ill, we want to make absolutely sure that healthcare workers have and use appropriate personal protective equipment to prevent them from being exposed. And this is important because as we inform individuals who are ill, if they suspect that they've been a contact or something like that, that they must report to a healthcare facility first that they have that suspicion so that healthcare facilities can take appropriate measures to prevent unrecognized exposure or have individuals just sitting in a waiting room or in an emergency department where healthcare workers might be exposed.
Do they have the necessary supplies to do that? Do they have enough masks, everything else?
We believe that supplies are adequate. There may be delays in the delivery, but I would need, or we would ask the hospital association or healthcare facilities to respond to that specifically.
As far as funding, where is that coming from for the test kits, and will we need additional funding as this goes on?
The funding is coming from DHEC right now, from our funds, but the U.S. government has approved either $8.3 or $8.9 billion to be distributed, and they're working on that methodology as to how to appropriately distribute those funds to the various states, D.C. and Puerto Rico, as well as to the tribal entities within the nation. So there are additional funds that are going to be distributed, and that will be very important as this continues because we do expend dollars, and it's wonderful for the U.S. government to step up to help public health departments across the country and states across the country in this expense.
Now, we know that washing your hands for 20 seconds is kind of the minimum amount of time, saying you happy birthday and everything. Can you just confirm whether or not the temperature of the water that you wash your hands in affects whether or not it kills germs successfully? Because we've been told that some schools across South Carolina don't have access to hot water in their school bathrooms.
No, the temperature of the water doesn't matter in terms of germ killing. It is for comfort, and you couldn't get the water hot enough to kill germs, so it is the soap and the warm water that is recommended, and the soap is what is effective. The temperature of the water doesn't matter.
Dr. Bell, we know the two now confirmed positive cases were the in her 30s-year-old woman from Charleston and the 80-year-old in her 80s woman from Kershaw. Can we get the age range of the other 5 presumptive positive cases?
We're just referring to them as adults because the actual age of individuals really doesn't matter. What's really most important is for the population to be aware, as the governor said, of those who are at risk of possible complications. So it is older individuals who can potentially experience complications, but the ages of the actual cases is not of necessary importance in terms of what we do differently from a public health perspective.
Dr. Bell, I know you said they were in, all of the presumptive positive cases were in stable condition. Are they all in good condition? Or is it just consistent?
They're all in good condition.
We know that the flu season, well, the flu has a season that comes to an end. Are we expecting this virus to go well into the spring and summer, or are we not going to know information about that?
Because this is a novel virus and we've never actually experienced this virus in a warm season, that's unknown, but we are looking at other viruses that are genetically similar to this, and respiratory illnesses tend to be more active in the winter months, but this particular virus is more we've had more transmission internationally than we saw with other genetically similar viruses. So it's really unknown if we'll continue to see high activity in the warm months.
Do we know if there are any South Carolinians that are currently restricted from traveling back to South Carolina because of this virus that they were traveling abroad?
If South Carolinians are being detained in other jurisdictions, I'm not sure.
So serious community spread in Kershaw County
Well, we want to emphasize that really just because we've identified these cases, that the message we've always given is really the same. What is needed, though, is for people to really take that message seriously. It's the same message that we give during every flu season, to stay home when you're sick. And we believe that people often don't take that message seriously. And so what we need now is not really a different message, but it's a behavior change so that people do take responsibility for protecting their coworkers and their community from disease spread, because if people are ill, we ask that they not be out and about and that they limit their activity from public gatherings, from work, and from school.
And for those that were already infected, is it possible for them to get the virus again, or do we know enough information about that?
The possibility of reinfection with the same virus, because this is a new virus, is unknown. It's unlikely.
Governor McMaster,
Sure.
when we talk about price gouging with hurricanes, we've seen the empty store shelves, hand sanitizer, clean wipes, things like that. Any statewide ideas of how to limit that, make sure stocks are running high here in the state?
What we ask is, been stated over and over, we ask people just to follow the advice and instructions that have been given about very, very simple things to do. And at this point, that's what they need, that's what everyone needs to do. Are there any further questions? Thank you for coming, and we'll keep you up to date. Thank you. Thank you so much.
Confirmed as coronavirus in the state.
So the numbers that we're getting in from that press conference, for those of you who are just now joining us, 31 people tested.
Right.
24 of those tests in South Carolina coming back negative, 7 of those coming back positive.
That's between 20 and 25% of those tested have tested positive for the coronavirus. However, with that said, the governor reiterating today there is no need to panic and just use some common sense here. If you are not feeling well or if you are going out and about in large crowded areas, just use some common sense when you go out.
So for those of you who are watching us who have students in Richland School District 1, you've probably already received an email from the school district talking about in part the fact that 5 students at 3 different schools have self-quarantined because they had indirect contact with someone who they believe could have had the coronavirus. What we're hearing from DHEC today is they were not consulted by the school district before that press release was sent out, before that notice was sent to parents, and they are not currently testing anybody in this situation for the coronavirus.
Yeah, they basically were pretty adamant when they said DHEC has not advised students to stay home or self-quarantine. Schools will stay open. State government will stay open. There's no shortage of test kits out there right now in South Carolina. If you call your doctor, if you feel like you need to be tested, you can be tested. The governor's saying there's likely to be more cases confirmed in South Carolina in the next days and weeks ahead.
Dr. Bell with DHEC says that she cannot stress enough that it's about good hygiene, hand washing, and if you do not feel well staying at home, there is a teledoc line through MUSC, the Medical University of South Carolina in Charleston. You don't have to go in the office if you don't feel well. Go to our website at WLTX.com. You'll get the information on the teledoc. You can call in, talk to the doctor about your symptoms, absolutely free, and then be advised by that doctor on what you should do next.
And finally, DHEC says they are seeing community spread in Camden. That is where the latest positive result in a DHEC lab came back from. Another individual, a man in Camden, testing positive in the DHEC lab. That still has to be confirmed by the CDC.
Of course, we're going to continue to follow this story for you, not only on air, but also online and on our social media apps and on the WLTX News 19 app. We have team coverage for you when you join us today for Friends at 5.